microphone in between speakers. And I think those actions have helped protect those of us who are participating, those of us who are speaking, and try to stem any spread of this. So thank you for that update. One other just general question before I get into the specifics of the proclamation or the executive order. As we're talking about testing and the continued expansion of testing, I have been receiving a number of correspondence from people, particularly in the downtown Silver Spring area, who say that there is no place within walking distance for them to be able to get tested, that they would either need to take public transportation or get in a vehicle, which many of them don't have, which is why they're asking. Are there any efforts to expand testing in downtown Silver Spring specifically?
Yes. So consistent with that again, and I know 20910, which is downtown Silver Spring, is in one of those zip codes. And so again, what we're looking to identify is not only venues that are more transportation friendly in terms of being walkable and accessible, but making sure, that we create the opportunity to be able to do walk-up testing as opposed to, having to have an appointment, those kinds of things. So our team is looking to identify venues within those respective zip codes that would be good candidates for the county to do testing, but also to identify community partners who have venues in those spaces already to support them in their testing outreach efforts as well.
Okay, well, and I think it's also important to note that as people have been fielding those questions to me, and I've been looking through the website, seeing the updates, it does not appear to me that the pharmacies, the CVS, Walgreens, the others are actually in that zip code are offering testing.
That's correct.
Which goes back to an equity problem. And so we need to figure this out so that people who live in that community are able to get testing without having to figure out transportation problems. Again, an issue that we've been talking about for a while, but it's becoming more acute. So two quick questions just regarding the order itself. Regarding pools, I know that there was some clarification. Mr. Drummer explained it a little bit, but I'm going to ask for a different explanation that maybe you can provide. It says that pools are open with restrictions, and so explain what those specific restrictions are. The 50%, the lap swimming, open swimming. Can you just share with everybody who's listening what pools are open and how they can best be utilized?
Sure. So the clarification in the amendment that was sent over reflects an acknowledgement that public-private pools can be open indoor and outdoor. The requirement is not that they have to be used for lap swimming, although that is the preference. But it does provide strict capacity limits in terms of how many people can utilize those spaces. Because again, the actual act of swimming itself is not as high risk as some other activities, but it's the other things associated with it, again, in terms of shared equipment and the ability to congregate in settings. And so what the language requires is that there are capacity limits that actually go beyond just saying 50% capacity. It says if you have a pool, you've got the square footage divided by 36, which gives you your number in terms of how many people could ideally safely physically distance themselves in a pool at a given time, as well as provisions to talk about how shared spaces and surfaces need to be cleaned on a regular schedule, again, to mitigate any potential increased risk of transmission upon shared surfaces.
Okay, thank you for that explanation. And last question I have was directly sent to me by someone who does youth programming in the arts space, and specifically the question is about the Phase 2 requirements regarding youth participating in indoor exercise classes, and specifically it's about a dance program that a constituent has. Are participants in such programs, indoor dance programs, required to wear masks even if they are physically distanced?
I think the expectation and consistent with our guidance for gyms is that we would expect people in indoor settings to wear face coverings while they participate in those activities.
And so let me just one follow up on that. Is it an expectation for people engaging in indoor activity, to wear a mask, or is it a requirement?
Well, in the language for gyms, we require that they wear them.
Okay, so gyms are a requirement, but other kind of activities they would be preferred.
I don't know how the indoor dance studio is being. I don't want to get to the weeds of these. I know Sylvia is on the call, but we are as the gym example. That's probably in my head the closest thing to what you're describing. We are requiring that they be worn.
Great. Okay.
Can I add a real quick comment to that? We are seeing, I think, observance-wise, so much of mask wearing is the public unity around mask wearing. So the more people who don't wear a mask, the more it encourages other people not to wear masks. And so we've very much attempted in this modification of this executive order, and sort of you'll see this paired up in our messaging going forward. If we're going to open things up, we have to have a strict expectation of people wearing face coverings, even in places where it might seem uncomfortable to do so. Largely because the more cracks in places that we allow them not to be worn, the more it encourages people to feel like there's some, they can draw back from doing it. And so I think we are intentionally being pretty strict in the use of those basic protections around good hand hygiene, face coverings, so physical distancing, because we know that while we open more things up, it runs counter to the message that there's still a huge problem in the community that we need to deal with.
And that is why I was diving into the question regarding requirement versus encouraged. So I appreciate your explanation. Mr. President, I yield back.
Thank you very much. Ms. Kinch, did you want to comment on the question about whether it's a requirement to wear a mask or not?
Yes, thank you very much for acknowledging me. The executive order would require participants in gyms, fitness classes, of which I believe the dance class would qualify, as well as other sort of exercise activities, to wear masks. So it would be a requirement.
Thank you. And I did receive an inquiry about the 200 square foot for all activity. The city of Gaithersburg has contacted us, and they wanted to know, because it says for all events, how did we come to the idea that it's 200 square feet? And I guess that's for indoor and outdoor events. And is there any? Could you clarify that in any way, please, Dr. Gales?
Excuse me. Sure. Actually, Dr. Stoddard was our capacity square footage guru in doing that. So the reason why we went to a square footage rule is we had a series of conversations with health officers across the state, across the region, and we could not find any scientific data that supported using capacity. Now, when we look at square footage, factoring in square footage and capacity allows you to think, okay, strategically, what's the physical space, and if I have physical distancing parameters in place to keep people 6 feet apart, recognizing, that's not always going to be, it's going to be fluid. What's the maximum number of folks I can put into that space to recognize that and acknowledge that? And so that is where that's the rationale behind using square footage versus capacity, as well as some of the preliminary basic science behind why that number is used, as opposed to, 500 square feet or 1,000 square feet.
But outdoor is different than indoor on that. I mean, you're saying it's 200 for any event, right? 200 square feet for any event.
Well, it's the same principle in terms of you being able to be within a space 6 feet apart, and to safely be able to physically distance from one person to another.
Okay. Councilmember Aubernoz.
Thank you, Mr. President. Many of the bases have been covered by the very astute comments and questions by my colleagues, but I'll begin with this just to frame it based as a follow-up on our discussion last week regarding the GO teams and the rapid response teams. And this is more of a comment for our county residents because I think all of us on the Zoom call know this to be true. The great news is that numbers within the county are going down, but just as in the entire state, the numbers in Prince George's and Montgomery are not going down at quite the same rate. The same is true within Montgomery County. And we continue to have significant issues in a handful of zip codes. And the numbers are probably higher than we realize because many of the people within those zip codes are in fact not being tested. And we have worked hard to establish a structure. And I appreciate Dr. Gales and Dr. Crowell, both of you, spending the time to respond to our questions. And I know you're going to be responding to the letter that we sent with more specifics on strategy moving forward. But I want our general population to understand while the numbers holistically across Montgomery County are positive, they remain troublesome and very challenging in specific communities. And so I do think moving forward, we're going to need to flood those communities with masks that are free, particularly as businesses open and many of the people that reside in these communities work in those businesses. And we are also going to need to triple down, not double down, on the efforts that have been taken up until now to ensure comprehensive testing within those specific communities, to address the transportation issues that Councilmember Glass brought up and other issues that are unique to those communities. And as we discussed last week, that's particularly true also within our disability community. And so it will be critically important that we provide on-site testing more so than we are now. And I know we all know that, but I just want to underscore that for our residents at home, that we are way not out of the woods. And in particular within those specific communities that we're all familiar with, Middlebrook, Long Branch, White Oak, that's where the highest concentrations of cases remain. So that's sort of a headline that I don't want to lose sight of. The second thing is with regards to pools. So I know a thing or two about pools. And the operation of pools and the management of pools is difficult even in the best of times. And this is going to sound like Debbie Downer here, but drowning is the leading cause of death in children under the age of 11 across this country. And like so many horrific and tragic indicators, it disproportionately impacts communities of color that don't have the same access to taking classes on how to swim. And so I am deeply concerned because I know that pools and their operation, again, even in the best of times, have a hard time recruiting lifeguards. It's a profession that for whatever reason, people don't take up as much as they used to. And so pools are going to be compromised in having to manage and operate these additional standards, which are all legitimate and are definitely necessary, and I completely agree with. But I think where I'm going with this is I would like most of the provisions that we put in place and most of the instruction is geared a little bit more for the business to kind of help them guide what the proper information is. But specifically as it relates to pools, we need something that is specific to families. And just as even before the pandemic, we encourage families to ask questions about what the lifeguard ratio is to the participants in the pool. We make sure that information goes out with regards to sunscreen. And my God, my 3-year-old, it's hard enough getting sunscreen on her. I don't know how we're going to keep a mask on. I don't know how that's going to work with our family going into a pool. But I think we need clear instruction and direction and guidance for families on what they should be looking for, how they should proceed. That's a unique set of communication than the general information we're providing, which again is a little more skewed towards the pool operators themselves. And my goodness, that needs to be bilingual. That needs to be in multiple languages. And we need to flood that information in those communities that are disproportionately impacted by drownings and other terrible indicators. And I just so I'll stop there for now, but just to underscore why it's important for us, and it's not going to be perfect. You know, we're relying on science to help, but when it comes to this particular item, it's going to be we're doing the best we can with the information that we have, and each family's going to have to make their own individual decision. But families who spend the entire data pool are going to have to rethink that strategy and rethink that activity. Spending, you know, pockets of time there is going to make a lot more sense. And I know pools are already organically implementing policies like that themselves, but it's something that I think we're gonna need to provide a little bit more direction on to families. So Dr. Stoddard or Dr. Gales, are there any plans for us to provide more concrete communication for families on how they should proceed, things they should be looking for before they go and do activities like going to a pool?
We could certainly, I'm taking it down. I think it's an excellent point for us to have that out, and we can work on it this week and have it out before Friday. I think it's certainly an absolutely worthwhile thing for us to do. And obviously, I think your point is well taken. It can't just be a communication. It has to be some actual outreach. And I'll certainly work with Director Riley on developing things coming from REC as well. Just to be clear too about the pools piece, while we are going to permit, we're going to allow sort of public pools to move forward. The county, to be clear, the county pools are not going to open on Friday. We still have some time to get in place. Exactly as you've said, getting the lifeguards in place is taking, it takes some time, getting all those things, the temporary employees. Councilmember Brown, you are as versed on this as anyone is, and so I'm certainly not speaking to you directly, but just I want to be clear that this is going to be a big communication point, but we know that we've got to provide some additional guidance along those lines to families, and I've taken that as a piece of feedback, and certainly we'll work on that this week.
Thank you.
And I'd just like to add, actually, to the first part of your remarks, Councilmember Albanos, I couldn't agree more. I get probably anywhere from 30 to 50 emails a day from folks asking to open up segments of society. Lots of folks are focused on, swimming pools for one, and other areas, and have asked why we don't, why are we limiting folks' liberties and limiting business? And folks don't understand that even though you're right, even though the overall numbers, and I feel like I'm repeating something that we've talked about before, even though the overall county numbers have shown improvement, we know that there's still pockets in our community that are disproportionately impacted. And that's related to COVID. That's related to any of the conversations we've had about health inequity and health disparities before. And so for those of you watching at home wondering why we don't just rush to reopen, is until everybody in our county is able to enjoy those good outcomes, we have to be measured and act with some sense of caution. And so again, that underscores our efforts to identify again those zip codes that have been hit the most and disproportionately impacted the most, to be able to develop strategies and be very active in terms of getting more testing opportunities there, enhancing the contact tracing, enhancing the outreach and education, as well as the increased linkage to other social support services that many of those communities need.
Thank you, and I'll end with this. I really appreciate the special attention you've paid to some of those constituencies, in particular our faith-based organizations. I think we've handled that with great care and understanding of the unique aspects of so many of these different sectors, but faith-based being one of the best examples. So I appreciate those efforts, and thank you all, and just underscore the mask issue that Councilmember Reamer mentioned earlier. We were at Brookside Gardens with my family. It was our first big venture out in 3 months, and it went really well. I was actually pretty pleased. And most people were wearing masks, but there were certainly some families that were not. And so I think just out of an abundance of caution, we need to continue to hammer that home, that is critically important for everyone. Thank you all very much.
Thank you. Councilmember Friedson.
Thank you so much. Appreciate it. Appreciate this discussion and the fact that we are moving forward deliberatively and thoughtfully and following your public health guidance. I also appreciate the fact that we're moving a bit in the direction of following the state guidance, but when it is safe to do so in a number of categories. Some of that changed from what was initially sent around. I do think it is helpful to make sure that we're as clear, consistent as possible, and that it's guidance that's easy to understand and for residents and businesses to comply with. Ultimately, we could come up with perfect guidance, but unless we can explain it to folks in an easy to absorb and understand way, it doesn't really do what we need it to do, which is to keep people safe. So I appreciate the fact that you are trying to strike that appropriate balance, and I think we're moving really well in that direction. Speaking of that, do we have an understanding of where we are following the state's guidance starting on Friday and where we are differing from the state's guidance? There's a number of the items in the executive order where we are now doing what the state is doing. We're just a little bit behind them because our numbers are dictating it to be such. And there's a number of areas where we are doing it in a different way than the state is. Do we have, I think that is some of the confusion and some of the discussion that we've heard up to this point. Do we have that detail? Do we have that written out?
I know that we have a specific crosswalk that does what the state is doing versus what we're doing. It's certainly something that we're aware of. I don't know if we have a rapid work, but I think that's something we could work to develop.
Yeah, I would strongly encourage it.
Okay. I think
if we had a chart, that there's a number of categories by category that are pretty specific in the chart that we have that goes phase 1, phase 2, and phase 3, and in the executive order. If we have a similar chart to say, okay, here's what phase 2 looks like. This is the state's, guidance, and starting on Friday, this is what our guidance is going to be. And if it's the same, great. And if it's not the same, just detailing what the difference is. I think it would be really helpful for folks to see that because they are getting a lot of competing and sometimes even conflicting information, and it's very hard to decipher if you're a resident or you're a business trying to figure out how to comply, how to make sure you're keeping your family and your employees and your customers safe. On the pools item, I appreciate it. I've also gotten a lot of questions on this. Some of it is because the order and the HHS guidance was different when it was released yesterday, so I'm glad we're trying to clean that up. I know there's a lot of moving parts here, and we're all trying our best to try to keep up. Have we received in writing the new executive order? Have council members? I know I heard our attorney did, but have we received the new guidance? Has that been sent around? Mr. Drummer or Dr. Stoddard? Or...
yeah, I'm not sure that we transmitted it to council staff. I'm not sure if it's been transmitted to council members. Mr. Drummer may be able to.
Yeah, I will send it around now. I'm not sure. I didn't realize it hadn't gone to everybody.
Okay, yeah, if we're voting on something, I think it'd be helpful for us to have before we vote on it.
Absolutely.
It seems like a fairly basic standard. Thank you for that. When should residents expect for the new clarified standards written out to be posted and published for their consumption?
So for pools,
yeah,
there's actually in the executive order, it's linked directly, and so there is a county website that already has it up. We'll just make sure that it's more readily available and advertised for people to see it. But you will see a direct link, and you certainly can share the link from the executive order out that states the rules.
Okay, so right now, if we were to share the revised executive order with constituents, they would get the proper and appropriate information.
There's a direct link in the executive order to the pool's guidance. Yes.
Okay, great. A question on gatherings. There's been a lot of questions of what is a gathering and how are we defining gathering. Could you just share that information of what the standard is for gathering? Are we using a definition from the state or from the CDC? Are we having our own definition? It seems like we've been pretty clear to define what is a food establishment, what is a certain type of activity, but it's a little unclear of what a gathering is, which seems broad to a lot of folks. Could you explain that?
Well, I think I think the governor removed restrictions in terms of capacity for gatherings. We haven't placed still a capacity of 50 at social gatherings. So everything from, getting together for some type of ceremony, some type of event, both informal and formal. And again, it is broadly defined. The CDC guidance in terms of, I don't know if they have a set definition of gathering. We've just been looking at it again as any type of event or activity that pulls people together, and capping that at 50.
Yeah, but can I give an example? Okay, so Brookside Garden that Councilmember Albernas raised, there's more than 50 people there. They're not 50 people at a specific individual event, and so so could a municipality, for instance, do a screen on the green with appropriate distancing that had 250 people but separated with social distancing? What would be the gathering? To me, the screen makes that a gathering. You're gathering to watch the movie, but you're also gathering to go to the garden or to go to a park or a trail. So it's unclear to me what, if I'm not connected to the people and we're all going to the same destination, I think that's some of the confusion of what is and what isn't a gathering.
Yeah. So I think the spirit of it is clearly that it's segments of space can't have more than 50 people in it to protect the space. Now, obviously, we've talked about, for example, could you have an event that had two adjacent parking lots that were not connected to one another in any way, but were essentially the same event operating next to each other? Because the space is segmented and you can't have interspersing of those two people, if they had 50 in each of them, assuming it met the one for every 200 square foot or whatever, assuming it met the spacing requirements, I don't think we would necessarily have an objection to that because it's meeting the spirit of the rule, which is people separated by more than 6 feet. The problem is if you have a larger gathering, you could easily say, well, then Dr. Stoddard, couldn't you have 250 people in a very large space and meet the same thing? The problem is the more people you have in a space, the more difficult it is to ensure that those guidelines are being followed. And so we've set the limit at 50 to try and protect from what we know will often happen, which is that even though you have the amount of space, people tend to, we're social creatures and people will want to gather together, and just having, segments that are, if it's barriered off and it's spaced, you have 50 people in it, that's permitted. If it's two adjacent barriered off locations, having 50 people in each is fine, so long as you can't, you're one in, one out kind of deal.
Great. And then just similar to that, in the gathering, I've been to a number of places and I've been told that our guidance is not that you have to wear a mask in public, but if you are in a place like Brookside Garden, for instance, or some other area where you're with your family, are we recommending, which are two different things, folks to wear masks? I've been to Brookside Garden, I've worn my mask, I've been very happy about it and enjoyed that as a place to be outside. But
as it currently stands in terms of those open public spaces, again, so our guidance is we're requiring face coverings where physical distancing is difficult to maintain, and that's part of the issue. So, when you're in a wide open space, I've never been to Brookside Gardens before, but when you're in a wide open space, again, some people choose not to, again, because they're within their particular clusters. So that's something that I think we could revisit and take a look at. But as it currently stands, the requirement is in spaces where it's difficult to maintain that physical distance. And then, some people would interpret to say this is a wide open space and I'm not required to do so.
But I would say, for example, we did see at some of the streeteries that people were waiting in line for like a rooftop patio, for example. Even though you're outdoors, if you can't be 6 feet apart, you should be wearing a face cover. So it's that judgment that is made. If you're in a confined space that doesn't allow you to maintain, not just transiently occasionally have 6 feet of distance between you and the other people around you, you're required to wear a face cover.
Appreciate that. I would encourage if that's the interest of what the health director is looking to the health officer looking to do, I think that should be clear. I don't think it's currently clear, and I would prefer, for me as a total non-expert who has completely taken the guidance of the health office, but I think it would be easier to get compliance if you required face coverings in all public areas, and then allowed an understanding that on the gathering side, that if people are are not connected, as long as they're wearing, everybody's wearing a face mask, that there's little difference between one type of public gathering and one type of other place, because I still think that is unclear, and I think that the being stronger on the face mask and more understanding on the strictness of the gathering outside, particularly in public places, I think would be helpful, easier for residents to understand. I think it would induce a lot more compliance with folks, and I think it would keep people safer, at least from my basic observations, being at parks and being at the streeteries, and looking forward to some of the other open street concepts that we're now talking about doing. Okay, last question. I'm glad there were a lot of conversations about the youth sports. I still think there's a lot of confusion about what that is. I still don't understand what a contact sport is versus a non-contact sport. I'm not sure if there's a definition of that. I've gone to the CDC website. I've seen the video. There's a baseball mitt and a baseball helmet, and there's also a tennis racket. As part of that video, to me, tennis would not be a contact sport, although you are touching the ball and maybe wiping your mouth, and doing other things. But it's just very confusing. Are we allowing organized games versus just drills? To me, it would be helpful if we had a to do and not to do type of list for those activities, both training and organized games and casual games. But I think there's a lot of confusion and questions about that.
We've been in significant team chat conversation during this hearing with Sylvia, and to be clear, this is not on Ms. Kinch, who helped draft this. This seems to be, we need to have some additional conversation to clarify this, because I think, and obviously we do have flexibility underneath Dr. Gale's authority as the health officer to issue a sort of supporting orders associated with some of this work. And this may be one of those areas where, just to clarify, given we're dealing in part with a couple things here, and I'm not putting this off on the state. This is something we need to deal with locally. But where the state makes changes, it doesn't always announce the changes until you just see them in an order. And so unless you're reading all the orders to the letter, you may miss certain changes that have been made. And so this seems like an area where there have been changes made in youth sports that were unannounced or certainly not clearly announced, and we need to make sure that they still meet the intent of what we wanted to do in Montgomery County moving forward. And so we agree that with youth sports particularly, there's going to have to be some clarifications, and depending on the nature of those clarifications, it may be a communications element, or it may actually have to have some force behind it, and so a health officer order may be required. We're going to take a look at that.
I appreciate it. I totally understand the challenges and concerns. I was going to say, actually, I think the confusion on youth sports and gatherings and some of the other things are not unique to us. I think that's true statewide. But if we're expecting our residents and our businesses to keep up with what the rules are and how to comply with it, we certainly need to make sure that we're up to date on what the rules are and how to comply with it. And just I'll reiterate how I started: clear, consistent, easy to understand and comply with. We're not going to find perfect answers to these questions, obviously, as you noted. I know you're working your best with your expertise and the information that you have in order to try to keep residents safe. I certainly appreciate that, and I support you in that. I just hope that we can all work together to make sure that we're getting this information out as clearly as possible. And I think that chart in particular between what the state is going to be allowing starting Friday at 5 o'clock and what the county is going to be allowed by the different items will really help us to be able to communicate that clearly to the public. So thank you very much.
Thank you. Councilmember Navarro.
Thank you, Mr. President. A lot of my questions have been answered thus far. I appreciate everybody being here to discuss this. Just a very general yet, I think, important thing to consider. A lot of conversation, no time and time again, has been centered around the issue, of course, of communication. And there's no doubt that, it's much easier to shut everything down. It's going to be so much tougher to do this gradual reopening and make sure that we're crystal clear on the instructions. So, I just want to offer just general observations about the critical nature of our communication strategy. And as has been mentioned before, this issue of it being, as concise as possible. Illustrations are great, so infographics, and literally this notion of how do we differentiate the message to businesses versus, families and the public. It's also, I think, a very good distinction. Very important. So I just want to, really offer that and reemphasize the importance of all of this. And I know this really falls under the communications team. So feedback on that as soon as possible, as clear as possible, so that everybody understands where we are in that process. The other thing I wanted to mention, so in conversations both yesterday during our Racial Equity and Social Justice Act first briefing at the in the Government Operations Committee, as well as conversations that I've had with Mr. O'Haney, who is now leading the COVID-19 communications effort, and also with Dr. Kroll. And I know Dr. Gales, we're going to have also a conversation tomorrow about the impacted zip codes. But really all of this falls under this notion of the approach to equity and understanding that disproportionality, knowing that those zip codes continue to trend in the way they trend. So as we're reopening and as we're recovering, it's really critical that we figure out how to integrate all of those efforts and be able to really do it under that umbrella of racial equity. I was struck by how in San Francisco, the first thing the mayor did there was to stand up this COVID-19 equity team that really focused on this issue completely, front and center. And so after yesterday's GO session, we, did discuss sending over to the executive a memo to ask to formalize this. I know it's been happening, but I feel like it has been happening in a much more informal way. But so we can formalize this equity team and really truly begin to fast track also some of the models that we've seen have worked very well, right? So we've had the conversation about the hub model. I know, Thriving Germantown, in collaboration, people like, Grace Rivera Elvin have been working on this, et cetera. It's a really nice template, and it really follows a lot of what we've said we wanted to do. So really fast tracking that and finding ways of standing up those kinds of places that the community they will know where to go and find all the information necessary. It goes to the issue of testing, it goes to the issue of contact tracing, food distribution, information in general. All of that can be contained. So I wanted to highlight that as a, I think, structural way also that will help, I think, all of us communicate in a seamless fashion all of this information. No doubt we have to make sure that people from the community, trusted members of the community, are working in these, involved in these efforts, but also the issue of the multilingual, multicultural communication, which again, I had a really productive conversation with Mr. O'Haney regarding how do we identify folks in HHS to have that capacity. I've mentioned in the past that Ms. Sonia Mora, who leads the Latino Health Initiative, she's amazing. I mean, her expertise in public health is one that we should, I put her name forward a long time ago, we should be using in terms of communications as well. So this is something I think that I'm very excited of how this is coming together. Something that I think we can continue to utilize and deploy, because this reopening in phases is going to take a while. So I look forward to integrating all of that, and as well as all the directives, because as everybody has mentioned here, we are, 24/7. We are answering questions to our constituents. we're trying to make sure everybody's doing, what they need to do. So the quicker that we have that infographics, simple things that we can put out there, I think the better and the smoother it's going to be. And I appreciate the conversation about, what happens if numbers start to go up, something that we'll need to definitely track. So just some observations and some follow-ups that will be coming, your way. And again, really appreciate everything that you have all done to get us to this point. Thank you.
Thank you. Councilmember Vice President Hucker.
Thank you, Mr. President. And thanks everybody for all your hard work as usual. I want to, a lot's been covered, but I have three areas I want to bring up. One is just a question to clarify, because I received a specific question from a owner of an indoor mall, I guess both indoor and exterior, saying that the guidance is unclear to him. And I read it here in number 9. They can open, as I understand it, Dr. Gales, as long as they allow customers to enter and exit interior entrances of merchants, but not to gather. And the stipulation is they have to comply with all the other measures, guidance under number 3, including masking and distancing and disinfecting. Is that all correct?
Yes, that's correct.
Okay, good. So does that mean, and he hasn't asked me that, but I'm anticipating, does that mean no food court, presumably?
At this time, that is correct.
And what about their interior play space with play equipment? That would be off limits too, just like parks, correct?
That would be correct, yes.
Okay. Anyway, I'll convey all that. Second, an ACAO had told me that tattoo parlors could open in phase 2, but then I see in 21E that they're on the list of businesses that remain closed. Am I missing anything, or are they remaining closed?
They are remaining closed in phase 2.
Okay, I gave bad information to a tattoo parlor owner. I have to clean up. Okay. And then 3, I want to ask you about nursing homes. I know they're not in the executive order, but this is our weekly briefing. A lot of troubling media reports this week. Problem isn't new. You and I have spoken about this quite a bit, and we brought it up here. The state is still, according to the media, underreporting the data on their state dashboard. Hundreds of cases and casualties are apparently missing from the state dashboard. Can you remind me, does that affect your reporting in your dashboard, or do you gather your own data that doesn't come from the state?
Sure. So that's an excellent question. And I think one of the other components that was brought up for clarity and my understanding and trying to find out more information is part of the underreporting was that when a nursing home may be cleared in terms of not having cases, that those numbers were taken off from the total count. The count that we have here is reflective of the line list that our disease control staff has in terms of reaching out.
They were taken off from the cumulative count of cases and casualties in the state?
So that was one of what was reported. I don't know if that's in fact the case, but that's one of the inferences in terms of why there is a discrepancy. The number seems lower some days versus where they were before. What I can tell you is, and again, I can't speak for the state on that, but that was one of the inferences from the article. What I can tell you about our data is informed by the line list that we have. So whenever there is a case that pops up in any of those facilities, we go in and we count. So we count the number of positives for residents as well as staff. We track over time if there are any new cases that pop up. So our total that we publish on the county website, it's on the same page. I'm thinking in my head with the dashboard. If you scroll to the bottom, we break the numbers down by nursing home facilities and non-nursing home cases, both for the number of cases as well as the COVID-related fatalities. And so both of those represented. Our numbers represent the numbers that we collect as a part of those investigations and are accurate as best as we can tell.
Right, based on your own data that's gathered and not just from the state.
Yes.
Okay. Thank you. A couple specific germane media reports this week. I think in my district, possibly in Councilmember Navarro's district, but Bedford Court Health Center in Silver Spring told a regulator apparently they hadn't established a separate unit for COVID positive residents, and the spokesperson for their parent, Sunrise Senior Living, refused to respond to questions. Althea Woodard Nursing Home regulator reported gowns worn improperly with holes in them. Administrator falsely reporting that he was overseeing an infection prevention system, but he had not been trained in it. And then also additional media reports that the state won't disclose which nursing homes have been fined. They say that several nursing homes have received substantial fines, but they haven't released any details on those. They had to be gathered under a Public Information Act request. Do you know which homes in Montgomery County have been fined, and do you know how much they've been fined?
I don't. If the state has fined them, then, the state has done that, and I don't have that information. Now, that said, I would enjoy having a conversation with you after this to discuss more in detail about those particular instances, so that I can find out more information about them and see what we can do on a local level to intervene.
If you find out about nursing homes that are out of compliance and haven't been fined by the state, do you have the authority to fine nursing homes separately or above what the state has fined them?
So it's a little complicated, but ultimately we do have some provisions in terms of where we can exercise some space in terms of the penalty process. Again, it's a little complicated, but I'd be happy again to talk with you offline.
And then just, I wouldn't enjoy that. I'd appreciate that. The opportunity. Thank you. This is something that's been going on for, at least 8 weeks or so now. I've heard from a number of constituents who have been fighting with nursing home management, really all over the county, some in Silver Spring, some in Rockville and Gaithersburg, to get information about their loved ones. It seems like nursing homes are still withholding that information, a fair amount. Generally, how would you characterize the state's oversight of nursing homes, and is there anything else that we could be providing you to improve that oversight?
Well, they have it's a tough job, and then in terms of the number of cases that have popped up in terms of trying to manage those cases and provide testing. So what I would say is that what we are doing on the local level to go above and beyond is to provide a tighter communication as best as we can to be up to date in terms of those issues. And when we find out those issues, quickly be able to triage them and address them. For example, the response that we have now in terms of stepping up to drive out the cases in both nursing homes as well as assisted living facilities is to go in and test on our own and provide that testing and do it on a weekly basis, again, so we can drive those numbers to zero. We have cleared a number of nursing homes who now don't have any cases, that had them before, as well as looking at other strategies to step up in terms of making sure that they have those provisions in place, whether that's through physical in-person visits or virtual consultation.
Thank you. And to be clear, you've been providing the testing. You've also been providing the PPE for nursing home staff that need it, correct?
So the testing, the majority of the testing that has come through has been provided through state provisions.
Right.
So in terms of the universal testing with the National Guard. Now the PPE that has come through is we have received significant provisions from the state that have been earmarked for the nursing home facilities going back to when the Secretary's first directive came out. I want to say it was in early April, talking about face coverings, those kinds of things. Now, there have been other opportunities where we have been able to tap into our supply to provide, particularly to the assisted living facilities who have not had a dedicated supply from the state for PPE, as well as providing additional PPE support for nursing homes who had additional needs beyond what the state has supplied.
So just to be clear, thank you. If there's any nursing home management or staff or residents or family members of residents who are watching or listening, they should get in touch with the county if there's deficiencies in any PPE in nursing homes in Montgomery County. Is that right?
Yes.
Right. Okay. People should know that they can do that. Okay.
Yeah.
I look forward to our follow-up conversation. Thank you, Mr. President.
Thank you. Councilmember Reamer.
Thank you. Okay, so to follow up on the discussion about masks first, or face coverings, I think it would be very helpful to have under item 3, which is kind of the very general operating, guidance of the executive order. just a very simple statement that reflects what we've been saying, what you've been saying, Dr. Gales, that all persons in Montgomery County shall be required to wear facial coverings wherever social distancing is difficult. Mm-hmm. And that simple, one statement there as a sentence in kind of the overarching component, I think would clarify a lot of other places where it seems to refer back to itself in confusing ways. And people just, I think this is one where we want to have a very simple declarative statement. I guess I cannot amend this regulation. This is the executive order. So I do want to ask about the process to receive a slightly different version from the executive branch so that we can approve, a different version. So that's the first one. And then related to that, the second item, if I'm understanding it now, I do see youth sports clearly being limited to 15 per the state's youth sports document. I see that now. Adult sports appear to be limited to 50 per our outdoor item. Number 4, I see Dr. Gale sort of having a, what? That wasn't necessarily what I wanted. But item 4 says sporting gatherings. Is that the same? Or so if I'm reading this correctly, it appears to me that 50 people is the limit for adult sports, 15 for youth.
So the facial expression I gave you was more of a.
It's the same one I'm having.
Yeah, so
we're on the same page about this.
That's clarify. So I think the sports gathering is in terms of event, but I think this, we can talk through that language because I want to make sure I know exactly what you're talking about in the specific.
Where is this? Where should I look for guidance about adult sports? Adult soccer teams that want to permit a field. Where should I find that? Earl, anyone?
Yeah, I don't think we specifically address adult. So basically we're extending what we're permitting to allow. And so technically by those definitions, and maybe we will need to clarify this, and what I'm getting from Ms. Kinch is that one way to deal with the question of the executive order modification is that we just have a complementary health officer order that can follow the executive order that states very clearly the requirement around masks, if that's something that council is amenable to, so that we can, but I think we agree in principle that this is the message that we want to be providing, is that regardless of setting, indoor, outdoor, or otherwise, if you can't maintain physical distance, you're required to wear a face covering. I think Dr. would agree with that as a principle. It's just we need to figure out exactly how to, I think that we could do that through a health officer order.
And when are we taking up the county council acting as a board of health order? That's, Bob, is that now or is that subsequent?
Isn't that
what we have?
Council will be acting as the Board of Health, but I think it would be incredibly confusing to have an executive order saying X and the Board of Health regulation adopting an executive order except for this. I think putting out Dr. Gales putting out a health directive to clarify the order or modify it in some respects is a reasonable way to go, or they can come back with an amended executive order in another council session.
Well, that's the issue. So for all this discussion today, to the extent that a change is needed, we're going to need to receive a new executive order and then act on an amended executive order. So we might act today on this order with the expectation that we might also have to act again on Friday if there is an amendment that we feel is important enough to merit an action. I would be fine with Dr. Gales issuing one clear, order on facial coverings. That would be fine. I think that that would probably serve the need to communicate with the public in a very precise way. Then the sports issue is a little different. I think we do need some clarification, because it does look at, it looks like 50 is the limit for outdoor activities, which I think is generally where we've been going, and that could be fine. But then it also seems like 15 is the limit for youth sports, and now I'm thinking why these two things are kind of at odds in terms of health basis.
Well, there's also the third possibility is for some things can just simply be put out as guidance as to clarifying what the executive order means. But the council doesn't have to approve a health directive from Dr. Gales. That would be something he has separate authority to do outside of the executive order, to restrict something that's in the executive order for as long as it's based on his opinion in science. He can do that. So that's one way to do it. Or they could come back with an amended executive order, and we can, you could approve this, and then they could come back with an amended executive order. You could not approve this, and they can come back with an amended executive order. Or you could approve this, and Dr. Gales could issue a health directive that clarifies some of the questions that have come up.
I'm happy
might be the better way to go,
I'm happy
and
to
then it
support,
doesn't have to come back to the council.
I'm happy to support a directive by Dr. Gales on facial coverings that's very broad. But that resolves that issue when we see that. On sports, I think we've got an issue here. It's confusing as to what sports are, and then I have to ask, to the county executives team, is what you intend that youth sports is 15 people limit, adult sports is 50? It doesn't feel like we have fully resolved what we want there. So I think we're going to need something from you. How to do that, I'm not 100% sure yet. We're figuring this out as we go. So any comment there is welcome.
Well, so clearly, I think even based on what the state is doing, it's 15 for youth sports, as you alluded to, and there is no limit on other gatherings per the state, and so we're enforcing a separate limit, and so that discongruency, as you said, from a public health perspective, and this is definitely Dr. Gale's territory, there is rationale for why certain youth activities are restricted in a way that's different from adult activities, because we know that compliance with the other things around physical distancing is more challenging for children. I have a 6 and a 10-year-old, and I see visual evidence of that every day. We know that, like for example, between 2 and 9, we're telling people you should wear face coverings.
Okay.
I know 2-year-olds are not going to wear face coverings as consistently as a 10-year-old or a 15-year-old or a 25-year-old. And so just recognizing that in the youth activities, we want to err on the side of being a little bit more protective, because we recognize that the other compliance issues are not going to be as good.
Okay. I think I can be okay with that, if that's where we're going. Just want to make sure that this is all intentional, really, more than anything. All right, thanks.
Thank you. Councilmember Rice.
Well, thank you. So I have a couple things that actually haven't been said, so I'm surprised towards the end. One of them is regarding when it comes to resources for businesses. So I'm going to try and go through these very quickly because I know the hour is late. We have the MoCo PPE website. And so I know personally of a business here in the county who went on the website and tried to acquire some of the PPE items. The shipping, just to let you know, so from a pricing perspective in terms of what we offer to our constituent businesses is very, very high. In fact, if you were to order $15 in masks, you pay $15 in shipping as well. So you pay double the price. And so I just want us to take a look at that and make sure that we're giving the best sort of setup, especially since other companies offer free shipping. It really is something that may be a pricing deterrent to a lot of businesses. So just wanted to highlight that for you. Also, one of the other things that's missing from that is the cleaning chemicals that are required by businesses. Since businesses now are required to actually clean much more frequently than they have before, especially when it comes to some of our businesses that turn clients in and out, a la hair salons, nail salons, etc. Those are the kinds of things where they're burning through those items much more quickly, and they're not available at grocery stores nor at home improvement stores. And so if we can look at the acquisition when it comes to those types of products to help and put those on our MoCo PPE website as well. I know it's not PPE, but it's along the same lines. I know that would be incredibly helpful to businesses because I know that they're struggling in that acquisition because it's not readily available. And I'm not talking about your big box stores and things like that who already have supply chains, but your mom and pop stores, your smaller businesses are the ones who are going to face difficult times in trying to procure that. I'll stop there for those two. If you have any comments, if not, I can move on to a couple of the other comments or questions.
I think both of them are reasonable things. We'll take them back, and I'll talk to Director Shetty about. I know he has a big pan in setting up the MoCo PPE, so we can talk about the shipping issues and cleaning supplies. From what we've said, so they're utilizing similar vendors to the county for PPE. We've also heard from our vendors on cleaning supplies that we're not having much issue acquiring them. So if we utilize a similar platform, we should be able to provide that support, assuming that the three businesses that are the back end of the MoCo PPE works for them. I don't see an issue technically with doing that, so let me go back and take that back.
Thank you very much. Appreciate that. So now, when it comes to facial coverings and when it comes to gatherings, it was a very interesting conversation because I think what's lost oftentimes when we talk about gatherings is about the increased risk that happens as you increase the number of people. The infection rates are based on, and risk is based on statistics. So the larger the number of people you have, the more likely it is that one of them is actually going to be infected and then risk infecting others. And even when it comes to, and again, I'm not a doctor, not an epidemiologist, I just read a lot. Even when it comes to some of those folks who are wearing facial coverings, we know that facial coverings are not the panacea to being infected, and people don't wear their facial coverings correctly. And so I wanted to talk about a couple things because I was actually out at the Kentlands last night. My daughter had her 8th grade promotion last day, so we went out to the Kentlands to eat outside, and I observed. And it was very interesting. I observed a couple things, and I'm not going to call the business out, but the one business that had tables outside did not clean their tables between customers. I had to remind them and did tell them who I was, but just said, hey, every time a person leaves, you need to clean the tables. That's part of the regulation. They begrudgingly, even though they didn't have anybody inside the store, inside the restaurant, and so nobody's really doing anything, but they certainly could have gone out and did that, and they did it when I requested, and that was all fine and good. But we need to remind our folks to continue to do that and be vigilant about that. The tables weren't spaced at 6 feet apart. They were actually a little bit closer than that. And so when you had the back of another table and patron, they're much closer than that 6 foot. It wasn't even probably 4 or 5 feet. Like, it was close to probably about 3 feet. And so we actually placed ourselves and had a table in between us and in between the next set of families that was out there. There were only 2 of us out there, fortunately. But I could see that running into problems and issues as well, just in terms of reminding people and really focusing on the spatial distance and reminding folks, while they want to try, they have minimal space, right? So they're trying to pack as much as they can to maximize. They're doing it at the detriment, the potential health risk of others and causing problems, because then folks don't want you to be there, and all that could do is cause a problem between patrons who don't want to be close to one another. When it comes to the wearing of masks, I will say that my take on it is that I'm seeing less and less people utilize them, while other people may have had a different experience. In terms of a majority, I'd say maybe it's about 70% now, and it seems like it's getting worse. It was much better before. And I think that it's because we're starting to open. And so that's why I do think that this guidance in terms of us utilizing masks, even when outside, look, the reality is this, and as a person who, and many of you go to the gym and exercise, look, there are training masks that folks use. So there's no such thing as not being able to breathe or exercise through a mask. In fact, some of our best athletes use them to make sure that their systems grow even stronger by utilizing them to deprive the body of oxygen to make sure that it can more effectively utilize it when it comes to exercising. And so from that perspective, certainly if you have health conditions, obviously those kinds of things, But as far as from an exercise perspective alone, it is not an impediment at all. I mean, I wear a mask every time I go snowboarding and skiing. And, you know, it's one of those where, again, it's right on top of your face, as many people who participate in winter sports do. It's a tradition that you do. And certainly, you know, it's something that has an impact, but certainly something that's not possible to be utilized. And so I really would hope that we continue to push the idea of utilizing masks as much as possible. And we should be using them regardless of whether we're walking outside on the street or inside a building, because it will help to minimize, even though it's not the panacea, even though it's not going to stop something and, you know, keep the virus from definitely spreading. The reality is that it does help in a lot of instances. And so from that perspective, I do agree with what Councilmember Reamer was saying. We do need that broad guidance to remind folks of why, even though we're opening, we need to continue to use a mask. So I'm just curious as to your thoughts about some of that and some of the pushback on folks who want to push back to you to say, well, you know, we shouldn't have masks in gyms and you know, outdoors and all those kinds of things, because according to what guidelines I'm reading when it comes to our CDC as well as other countries, one of the ways in which they've been able to minimize is by religious use of masks, right? And so that's been one of the things where they've been able to actually eliminate. They actually had mandatory requirements for everyone to wear a mask, regardless of whether you were inside or out. So if you could comment on that, and also about the number of people and the gatherings, because that's the other thing, because the larger the gatherings, the more people you have congregated together, the higher the percentages go. So if you guys could just comment on those.
Sure. I think the first component, great question. So for the first one, in terms of masks, for the folks at home, I think this gets back to an earlier point in the conversation in terms of us not being out of the woods. I think that the thing for folks at home to understand is we've been able to see our numbers are improving because we have kept these procedures and protocols in place for a longer period of time. And it's important that as we twist the faucet, not turn it all the way on, but as we twist it, that we remain even more vigilant, because we can really drive this out of our communities. And it's a combination of all of the different things that have been mentioned on the call today,